if the kidneys regulate acid-base balance, how then will alkaline diets help you? How then will you end up having an alkaline environment around cells when the kidneys are actually balancing this homeostasis? It's called homeostasis. How? So these kidneys should be protected by all you have. And the beauty about the kidneys, yes, at some point, unlike the liver, because the liver rejuvenates so fast, you just need about 28 days of appropriate dieting and the liver comes back. But for the kidneys, the recovery is very slow. And when you get to basically stage 4 and stage 5, chances of recovery are very minimal. They are very slow. So why would you wait to get to stage 4 and go for dialysis? When you have your kidneys functional, it is their natural role to excrete salt. So then I want somebody to explain to me how salt causes hypertension. How does salt cause hypertension when it's a natural role of functional kidneys to excrete salt? It will only be a problem. Salt will only be a problem if you have dysfunctional kidneys. And hello, my people, what causes dysfunctional kidneys? Number one, of course, on the list is sugar. Even when you say alcohol, alcohol is sugar. So another cause of kidney disease, of course, infections, okay? And where do we get infections? Sugar feeds infections. It's that simple. It's evident. That's why diabetic people always have urinary tract infection, recurrent yeast infection, because infections are fed by sugar. Number 2 is the toxins and the chemicals and the poisons. Number 3 is the drugs, medication. Yes, this is who? Fiction jame, medication. Yes, anti-cancer drugs. The reserve antibiotics. You've heard of vancomycin? You've heard of the streptomycin? You've heard of the most common antibiotic that is abused everywhere, that is called gentamicin? Do you know that drug? Do you know that injection? These are the antibiotics that cause you problems. The polypeptides, polymyxin Bs. Those antibiotics that are reserved for conditions that are resisting other drugs, they're actually a problem in the kidneys. And that's why I told you every drug comes with side effects. Anti-cancer drugs, immunosuppressants, the steroids. As you take that prednisolone every time, as you pump that inhaler, if you're asthmatic, you're actually going to affect your kidneys. You start having water retention. Now you start having those swelling legs. And you go to hospital and your doctor tells you, you should lift your legs up so that water drains back. Now, listen to that. Listen to that statement. Now you should, as you sit in your sitting room, make sure your legs are raised up. Now you're raising legs up when you have a kidney problem. So where is that water going back to? Hey. Sometimes I just hear these stories and I'm like, where did common sense disappear? So yes, you've raised those legs up as you eat popcorn and watch a movie. As you eat those potato chips and the crisps and you enjoy your movie. My friend, where are we taking that water back to? I want to understand that statement. So drugs like non-steroidal anti-inflammatory drugs are very simple drug. The painkillers. The painkillers. You guys, ladies, you use these drugs to alleviate pain during menstrual cycle. Did you know? By that, let me explain the problem with using NSAIDs. When I talk about NSAIDs, I'm saying non-steroidal anti-inflammatory drugs. So for the pain killing, we have different drugs. We have one which are steroids, the prednisolones, the dexamethasone, the hydrocortisone. Those are steroidal anti-inflammatory drugs. The other ones are the non-steroidal. They don't come from the steroids. So non-steroidal anti-inflammatory drugs: diclofenac, ibuprofen, meloxicam, aceclofenac, celecoxib. Which other one? Which other one do you know? The painkiller that you know, apart from paracetamol. Which other painkiller do you know? Mention that painkiller in that comment section so that I can actually tell you. No, paracetamol is not an NSAID. It's not. Because paracetamol does not have anti-inflammatory activity. It only kills the pain. Zulu MR. And I saw this Zulu MR when I was talking about that video that I was talking about today. So everybody was responding on the Zulu MR. Listen, Zulu MR has a muscle relaxant and has an NSAID. Betapin is a narcotic. It's not part of the NSAIDs. Mefril, yes, it's there. Myospaz has an NSAID in it. Tramadol is a narcotic. It's not an NSAID. Naproxen, yes, it's there. Aceclofenac is there. Cipladone is paracetamol in higher doses. It's not there. Paracetamol is out. Diclofenac, yes, it's there. Neurofort, no, that one is a vitamin B supplements. So it's B6 and B12 and all those B supplements. So it's not there. But Zulu is there. Buscopan is not. But the combination of diclofenac and Buscopan, which is hyoscine butyl bromide, is there. Indosit is what you call indomethacin. Yes, it's there. All these ones that you're mentioning, Brufen, which is called ibuprofen, yes, it's there. Those are basically what you call the non-steroidal anti-inflammatory drugs. Now, NSAIDs, not only do they destroy your gut wall to expose your stomach wall to HCl, that's how they cause, yes, pyroxicam is also there, chariot. That's how they cause gastritis. They are also acidic, so they destroy the wall directly again. So they cause you an inflamed gut. But they limit, actually they narrow, they constrict the blood vessels that supply the kidneys. Listen to that statement keenly. And if you have a kidney problem, don't ever take an NSAID for pain. These drugs narrow or constrict the blood vessels that supply the kidneys. When they constrict that blood vessel that supply the kidneys, the blood flow towards the kidneys is now cut off, is limited. You are now starting to kill the kidneys again. That is necrosis. So one of the major side effects of this overuse of these NSAIDs is a kidney disease, kidney damage. So imagine yourself taking fruits and honey, taking sugar, taking milk, taking ugali, rice, chapati, and all those carbohydrates that destroy the kidneys. And then you add on a painkiller because you had a headache and you're using this painkiller. Most of you swallow these painkillers every evening. Oh, I have fatigue. Let me take this one. Oh, I have this. Oh, my joint pains. I ate meat and I got arthritis. I have gout. Let me take this drug. These are good. And they're sold over the counter. Recipe for disaster. Recipe for disaster. So you're destroying those kidneys. Sugar plus the drugs, you're destroying those kidneys. Inhalers, which have the steroids. Some inhalers just have salbutamol, which is the only one, but some have combinations of salbutamol plus either prednisolone or beclomethasone or all these inhalers that have the steroids. So for the steroids, you have the ones that end with ONE, dexamethasone, hydrocortisone, beclomethasone, those ones. So you end up messing those kidneys. And let me tell you something, ladies, this is for you. When you use that NSAID to kill pain during menstruation cycle, remember this, that wall that is useless now, it has to go out. That's nature. You have to slough it off so that it goes out and now you develop a new wall waiting for a new baby or a new implantation. What happens is the reason why that wall gets out is something called prostaglandins. These are basically hormones that cause contraction of the uterine wall so that you slow off during menstrual cycle. Now, NSAIDs work by inhibiting prostaglandin synthesis. So they block the synthesis of those prostaglandins that help you in contraction of your uterine wall so that you get a normal menstrual cycle. So when they block that contraction, what do you think will happen? Those people who use high doses of diclofenac and meloxicam every other time you have a menstrual cycle, instead of fixing the diet so that your hormones balance and you have a smooth cycle, you are now fixing the symptoms by taking an NSAID, and now you're blocking the contraction of the uterine wall, and then you're retaining that useless wall. As you retain that useless wall, the next thing that is happening is now inflammation and now infection. So you're getting recurrent infection because of retaining that useless wall that was already destroyed and supposed to go out with the menses. But now you're using a drug to block the contraction of that wall. You block the synthesis of the prostaglandins that help you in contraction of that wall. And now you retain that wasted wall. Recipe for disaster. Let nature take its course. Your great-grandmother did not use an NSAID. Why do you think it's time to fix? And this is for those people who need to fix their problem. Now listen, when you have endometriosis, we told you fix the estrogen. When you have painful menstruation, fix the estrogen.